Medicare's annual enrollment period is open now through December 7th. So if you're eligible for Medicare, now's the time to consider your options. People's Health Representative Karl joins us now to dispel some common myths about Medicare. Good morning, and thanks so much for joining us.
Thanks for having me.
Now, everyone knows the word Medicare. We've all heard that, but some people may be a little fuzzy on exactly what it means or who it pertains to.
Yeah, so Medicare is a federally funded health insurance program for people 65 and older, or for some folks that are under 65 that get Medicare through disability. So Medicare has 4 parts. Part A is for inpatient hospital, when you're in the hospital. Part B covers you when you're outside the hospital, for doctor's visits, those types of things. Part C is private insurance company for insurers that are contracted with Medicare to offer Medicare beneficiaries their benefits. And then Part D is for your outpatient prescription drug coverage at the pharmacy. So it's those types of coverages.
And so even people who are covered and know they're covered, if you're 65 or older, if you have some disability, you don't know everything about it. You're kind of confused about some things. And there are a lot of common myths, right?
There are a lot of myths. So let's play a little game, whether it's true or false.
He's handing me the card.
You'll go ahead. We're going to play a little game show here. So myth 1 is Medicare is only for people ages 65 and older. True or false?
I do know that one. False.
That is correct.
Yes.
So Medicare is for people 65 or older, or for people who are receiving Social Security disability benefits for 24 months.
I knew that one because we kind of talked about
that.
We
did. I wanted to start out pretty easy for you. So myth 2, Medicare doesn't cover everything.
True?
That is true.
Really?
As good as the original Medicare is, it doesn't cover everything. Now, Medicare Advantage plans offer things like dental, vision, fitness center memberships. So it is advantageous for people to take a look at those Medicare Advantage Part C plans.
Okay.
Yeah. All right. Myth 3, everyone pays the same amount for Medicare.
True?
That is false. So for Part B of Medicare, the premium is income adjusted.
Okay.
So for people making over $85,000 a year, it is adjusted based on their income.
Okay.
And the last one, you can enroll anytime you want once you're in Medicare.
False.
That is false. So typically you have to wait for the annual enrollment period, which ends December 7th. It runs October 15th to December 7th. So now is the time for people to take a look and make a choice on their Medicare for 2018.
Okay, so as they're running out of time, is there any way that they can learn more information, or can they enroll on a website?
Yeah, they can enroll at peopleshealth.com. They can call us. We have a call center that's answering calls all day for all the way through to December 7th.
All right, Mr. Karl, thank you so much for joining us.
Thanks for having me.
All right, nice.